We're very adamant about patients keeping their 6-month cleanings, mainly because people that are not used to that typically come in when they're hurting. And so and a lot of times they'll have multiple problems and they want to fix that one thing. I tend to like to look at dentistry more comprehensively. All the teeth kind of work together. And it's kind of like one of your body parts. If one of your fingers is not working correctly, it's hard to hold on to things with your hand. And so teeth are kind of the same way. I mean, they all distribute forces when you're chewing equally. Things tend to shift. So what I like to, mainly education is the most important thing with a patient, just because they just don't know. They may have grown up in a household where they just weren't given that opportunity to go every 6 months, so they don't know any differently. So I kind of enjoy educating people, and my staff enjoys educating people about how important it is to come every 6 months, because I can find things sooner. And also I can look at things comprehensively. So we like to bring patients in through the hygiene program where we can kind of come up with a plan. But when they come in on a 6-month basis, you kind of avoid the major things like root canals and toothaches and things of that nature. We can, with proper diagnostics, we can catch those things a lot earlier. And so that's why it's important that they come in for their 6-month cleanings.